The following program is brought to you by the American College of Healthcare Executives.
When I first came to this organization, I walked in with a group of information technologists, and I said, "Tell me what you do here." And they said, "Well, I'm an IT guy, and I'm a programmer." And I said, "No, what do you do for patient care?" And they just looked at me stunned, like, "Well, I'm not a doctor, I'm not a nurse." And I said, "Well, if you can't tell me what you do to help the people that render care, why are you here?" And that's it. Everybody here has one purpose, and that's to deliver high-quality care.
There are over 100,000 executives working in America's healthcare settings. We are going to meet a few of them, and we'll meet some students preparing for this challenging career. We've already met Chris Van Gorder, President and Chief Executive Officer of Scripps Health in San Diego, California.
I worked as a security guard in a hospital for a period of time, and then I became a police officer. After several years, I was injured in the line of duty and in and out of hospitals for a year. And at the end of that year, the city retired me as a police officer, and I went to the hospital for a job, and they hired me as a department director in support services. I became close to the chief executive. He became my mentor, in essence, for life, encouraged me to go back to school and get my postgraduate degree in healthcare administration, which I did. And I then started the progression through healthcare administration, from administrative resident to a vice president position, to senior vice president, executive vice president, ultimately the chief executive officer, and now CEO of a system. We need to go into the community and be where our patients are, because most of our work should be in the prevention area, not in the let's fix it once it's broken area. We're going to have to rebuild this system, and it's going to be the young healthcare leaders of the future that are probably going to be the ones that come up with the new mechanisms to fix the overall system. I mean, you can enter in a doctor's office and be an ambulatory care manager or administrator. You can enter into a large medical group like Scripps Clinic, and there's an array of frontline early management supervisory jobs, be that in imaging or the laboratory, or we even have an internal consulting arm here. When I came to Scripps, I volunteered with the Red Cross, became a Red Cross instructor in CPR and first aid. And again, I got my EMT as well. And so I teach CPR and first aid skills to the non-clinical people, most of them here in the corporate offices. I'm also a reserve commander in the Sheriff's Department, in charge of the Search and Rescue Bureau. And I teach the medical module as well for their academy. And I go out and actually handle calls in the desert for search and rescue, and we deal with a lot of trauma patients out there. And I get this enormous reward, the sense of reward, because I know exactly what our doctors and nurses are facing in the emergency room, because I do it in a different setting. I'm probably the least important person in this organization to the patient. The patient could care less that there's a chief executive sitting in a corporate office somewhere. My job is the health of the organization. If I do my job in the background and I create a motivated workforce and an educated workforce, the quality and the level of care improves, and that's the value.
The nuts and bolts of workforce education is the responsibility of Stephanie Becerra. She's learning leader at Scripps Center for Learning.
Well, in healthcare, you really want to look at retaining the best. When you make a large investment to recruit employees, you really want to have a program at your institution that's going to keep them there. And so Scripps is really committed to continually grooming our employees, to having leadership opportunities, to having training opportunities that will constantly keep them at their best. I completed my graduate work in education, really focusing on instructional design as well as adult learning theory. So it's been a perfect match because the Center for Learning really is looking for individuals that are able to identify how do you create a learning opportunity that's going to meet the unique needs of adults, especially considering the healthcare profession where it's changing constantly. The senior leadership at Scripps is completely behind learning. They really have a vision to make Scripps as an organization an internal university where employees are consistently able to pursue lifelong learning opportunities. That's really essential. Being able to imagine and see what it is that others cannot see, and being able to have that ability to execute, that discipline to make it happen, and the people skills.
People skills have always come first with Allison Pittman Giles, President and CEO of Catholic Medical Center in Manchester, New Hampshire.
I started out as an occupational therapist in the mid-70s and loved starting at the bedside, taking care of patients and learning about really the catastrophic experience of a patient and a family in a hospital. So for me, I learned from the bedside up, but I also learned that I was better at management and leadership. So for years, every time someone left a job, I would offer to take their department and say, don't pay me any more money, let me take over psychology or the alcohol treatment center or whatever it was. When I took over as the CEO of Catholic Medical Center, we were in a very difficult position because the community thought we were going to close, and they said, we're going to save this hospital. And for 2 years, I would say, these employees would say, we'll walk over hot coals, whatever we need to do to bring this hospital back, we'll do. It was the easiest job as a CEO because they could also say, we don't really know what a CEO does, but what we know is if we don't have a good one, things are really, really bad around here. And now we know that we have a good one because things feel really good around here. We still don't really know what you do, but we know that the place is alive and vibrant and we're excited about it. And it was enormously gratifying. My goal is to be visible, to be supportive, to try to provide the best working environment I can, the most understanding and supportive environment, and respect for every single person in the organization. And I meet every new orientee, and I shake their hand and have them talk to me and say, your job is to carry on this culture and to make the patient the center of everything you do, and to know that you can make a huge impact on that patient's life and their experience. And even the high school kids that are kind of slumped in the back who are going to work in the kitchen sit up and realize that when they deliver the tray for dinner, they can have a big impact on that patient and family's experience. And that's probably the most fun that I have in my job. The Mom's Place is probably one of the parts of our organization I'm the most proud of. When we were merged, first thing that moved away from here were all pediatric and maternity services. And nobody thought we could bring it back because there's a big, big program at our competitor hospital. So we did focus groups with women. What they wanted was a country inn. They wanted bathrobes, and they wanted to feel as though they were the center. They were the ones in control of the birthing experience. It's been wildly successful. We went from 0 to now 800 deliveries a year, which is more than we've really ever done here. And we hear nothing but positive feedback. And we've even thought we may use the same model in some other areas of the hospital for women's care. Now we've gone through and realized we now need to build 10 new state-of-the-art operating rooms. They're too small, they're undersized, they're circa 1978, and we're doing cardiac surgery, and we really need to have more space. So we're underway with that new project. I guess the most important thing is that they have good emotional intelligence, good people skills, and they have a positive attitude, and that they've got to love every job they have along the way. Because if you love what you do, you're seen as somebody who can do more. You've got to be willing to try to do things that you don't know how to do and be willing to take on stretch assignments. That you've got to always be respectful and I guess maintain your humility. And I have a daughter who's a junior in college who wants to go into healthcare. And what I've said to her is, go out and volunteer in organizations, not even necessarily healthcare organizations, but go volunteer, and she actually did for the Red Cross. I would absolutely encourage her to look at an MHA program that would provide her with not only the great education and fund of knowledge, but a residency program.
What's an MHA program? We went to Trinity University in San Antonio, Texas to find out from Department Chair Mary Steffel.
What you learn in an MHA program is kind of a blend. You learn the basic managerial skills that you would get in any business degree program at the master's or advanced undergraduate level. So you learn basic managerial skills. You learn about the healthcare field. You learn how those managerial skills are applied to health. Many of our graduates end up in hospital positions, and that's probably the largest group do end up start out at least in hospital management positions, department directors. Occasionally they'll graduate and become assistant administrators, usually of small hospitals, analysts, special projects coordinators, and then they will gradually move up the line and We have now, many of our alums are CEOs of hospitals and hospital systems. Others will start out in the hospital setting and then move into ancillary positions outside the acute care hospital. Practice management, consulting firms, organizations that serve hospitals and the healthcare industry in various ways. The class that graduated last year, there were 25 in our full-time program. 24 ended up working in healthcare organizations, and the last one ended up in an ancillary service that serves healthcare. Healthcare management is a field where you can do good and do well. Our students make a decent living, but they also feel that they're making some kind of contribution to society. And all of them will come here with that mission in some ways. We expect an applicant to have done their homework and have some kind of understanding of what healthcare is all about. And if they don't, we maybe suggest to them that they wait a year and go out and find a job in the field. And if they can't find a job, then at least volunteer in a hospital or other healthcare organization. And in fact, one of the things that we do now, one of the strategies we use with our students on campus is to try to get them involved either with a paying job while they're a student or on a volunteer basis in a local healthcare organization. That enriches their understanding as they go through our curriculum. It also helps to build their resume as they start looking for a residency placement. It's a one-year residency program that is part of our field, our program of study. It's prior to graduation. And in that, the students are working in healthcare organizations, so they're both students and learning to be practitioners. It's a wonderful opportunity. The residents have access to information, typically, that they won't have again for many, many years. They often attend board meetings. They'll go with their preceptor, the CEO, in many cases, to all kinds of high-level committee meetings. And they'll just learn, and they'll also have an opportunity to rotate through all hospital departments. And that includes anything from a clinical department to housekeeping to dietary, so that they learn the total picture of a hospital. It's a wonderful opportunity that the typical entry-level employee never gets to have.
We thought we should meet one of these administrative residents to find out if it's really that wonderful.
I've been with the organization since the beginning of this year, and started the year by getting involved in departmental rotations to get me a better understanding of the organization. I've also had the opportunity to work on a number of different projects, providing support to members of the executive team. One of the first projects that I got involved in this year was became a member of an outpatient satisfaction task force. I was working closely with our Vice President of Marketing Communications on trying to provide a better experience for our patients and their families when they come in for an outpatient procedure. We also looked at our ambulatory surgery process, and we really took an approach to kind of analyze each step that the patient went through, starting with admissions, going up to the lab, going to radiology, and try to streamline that process as much as possible. My preceptor this year is Don Beeler, who's President CEO of Christus Santa Rosa Healthcare, and really we've had a wonderful relationship. He's really dedicated a lot of his time to me. He's had an open door policy. He's always welcomed my questions and invited me to all of the meetings that he gets to attend on a regular basis as CEO. You really have to make a name for yourself throughout the administrative residency. Again, taking the initiative and approaching different members of the executive team and offering your assistance and support with different initiatives that they're working on. And once you have the opportunity to work with one of the executives and they see the quality of work that you deliver, you start building some credibility and they start giving you more and more responsibility. And eventually that'll lead into a permanent position, which is the idea at the end of the residency. I've recently been appointed as assistant administrator here at Christus Santa Rosa. I think that the administrative residency as well as the Trinity program really prepared me for this new role that I'm about to take on. Initially, I'm going to start with two departments that I'll be overseeing that I'll have operational responsibility for, and the lab and the cardiopulmonary departments are those that I'm going to be taking on as my departments. I'm also going to be heavily involved with medical staff relationships and working to improve and maintain the relationships that we have with all of our physicians. I'm going to continue to be involved with patient satisfaction, because that's something that everyone should be involved with in the organization.
Enrique's experience sounds amazing, but we thought you would like to meet some MHA students just starting out.
From the beginning of my life, I always knew that I wanted to do something in healthcare and service. But as I matured and entered college, my undergraduate education led me towards business and communication. And then after combining all those together, I knew that healthcare administration was the perfect match for me. And I also see it as just continuing the trend in my life of serving the community and trying to end some of the disparities that people deal with on an everyday basis.
My father's a physician, and I would go to his office a lot of times and just sit there and go into the patients' rooms and meet with some of the patients as well. And it just, I could see what a difference he was making in their lives, how he was talking to them, making them feel better. And as I went to college, I thought about healthcare, but I was also interested in IT. So I started with my career in MIS, and I went into that. But I just didn't feel connected to that industry at all. I didn't feel that connection that I felt when I was sitting in my father's office.
My undergraduate degree is in public relations. My first internship was at the state capitol, and I worked on the healthcare expenditure committee, but I really didn't know what I wanted to do at that point. And after that, I pursued a lot of different internships in entertainment, sports, you name it. But really, I kept on wanting to go back to healthcare, because after exploring all of these other career opportunities, I knew that this was the only one that had a bigger meaning to me, that I could actually have an impact in people's lives. I thought about, my mom was in the hospital and how much it meant when the hospital administrator sat down with us, and just how much better we felt, just knowing that we were in good hands, and I would love to be that to other people. And it's huge, it's an amazing industry, it's growing, and I'm really excited to be a part of it. I think it's even different than getting an MBA or a different kind of degree, because we're all here for the same purpose and we all want to help people.
I think we're the new generation. We can bring new ideas, new talents and skills into this industry.
There's so many opportunities right now, and there's so many changes going on with policies and just integrating technology, that I feel that we really can do anything that we want to and change how things have been in the past. Correct some of the wrongs and put everybody back on the right path.
I want to work in a large hospital, maybe do something in marketing or do something in policy with the hospital, and try to make a difference through legislation.
I can see myself working as hopefully a CEO or something, or as a hospital administrator in a major facility, but mostly focusing on women's and children's health. That's a passion of mine.
I see myself working in the system of hospitals, and working on improving those small, minute details that may make a large difference in saving costs and saving lives, just making that difference.
Before we go on, we want you to know that the MHA degree is only one way to become a healthcare executive. You are going to need a master's degree, and these are several common choices: Master of Health Administration, Master of Business Administration, Master of Public Administration, and Master of Public Health. At the end of this program, we will tell you where you can get more good advice about choosing an advanced degree. Next, we traveled to Huntsville, Alabama to learn more about healthcare executives in the armed forces from Lieutenant Colonel Jesse Tucker.
I joined the Army for money for college, and I only intended to do maybe 3 years, my initial enlistment as a private. As I was getting towards the end of that time period, I realized that the Army had quite a bit to offer. There are a number of opportunities to do good things for people, humanitarian efforts, and then two, there are a number of educational opportunities. I have a baccalaureate degree from the University of South Carolina in Business Administration. I have an MA in Management from Bowie State University, an MBA from Troy State University, and my PhD is from the University of Alabama at Birmingham. One interesting thing about the Army is that you'll change assignments anywhere from 18 months to roughly every 2 years. I actually began my career at Fort Meade, Maryland, in the 85th Medical Battalion. That's the unit I went into combat with during the first Gulf War. Then I came back and have been assigned in Texas, and again in Germany, Georgia, here in Alabama does put a bit of a strain on the family and a bit of a strain on an individual's way of life, but it's definitely exciting, and you get a wide range of opportunities that you ordinarily probably would not have. We are becoming more in line with what civilian healthcare organizations consider to be important, i.e. financial and fiscal responsibility in terms of accountability and performance-based budgeting are just a few examples. We are definitely being required to cover our costs, and in some cases are required to not so much generate a profit, but to generate a certain degree or a level of revenue that I'd say about 5 to 7 years ago was less of a concern. Many of our soldiers are actually in combat roles, and those positions are now being filled by civilians. My facility here is largely a civilian facility. There are a few military, but roughly 70% of the staff members here are civilian staff members. Many of my key managers and leaders are civilians. What I look for in terms of a healthcare leader or a healthcare manager is someone who knows how to think and decide and act, and doesn't have to be told what to think, decide, and act. The most challenging aspect of being a healthcare administrator, I think, is balancing the business of healthcare and the care of healthcare. I would tell any young healthcare administrator that's coming in is to, again, be flexible and look at what's going on in the civilian sector. You have to be attuned to what's going on in the civilian sector of healthcare management to be on the cutting edge in the Army. One of the significant advantages of being a soldier is that you can retire at a relatively young age. I joined the Army at 17 as an enlisted soldier, became a commissioned officer shortly thereafter, a few years thereafter, and right now 39, and I'll be able to retire in about 2.5 years, which gives me the opportunity to then to pursue a second career in healthcare, as a healthcare executive, as a researcher, as a consultant, or even as a faculty member, teaching at a college or university.
Back in the civilian world, Dan Jones has also had an amazing career as a young man.
I started my professional career after graduating from Virginia Commonwealth University in Richmond, Virginia, with a master's in health services administration. I had the fortune through that program to do a 1-year residency in New Orleans. And from there, took the opportunity to expand my horizons and actually went to work for a physician practice management group under the same company, where I got to see the day-to-day operations of a physician's practice. 2 years ago, had the opportunity to again advance my career as the Chief Executive Officer of our new development. We're just a few short months away from the opening of Centerpoint Medical Center, which has been a 3-year project. The last 2 years have been oriented towards construction, but that first year was probably one of the most arduous. I spent months and hours upon hours of each day and each week, weekends, nights, having one-on-one individual discussions with community leaders, having community forums with the support of the city council members and the mayor, and it was a very challenging discussion, literally suffering slings and arrows of community outrage and concern, and taking the time to educate them on the benefits of what we were going to do. I'd contrast two aspects that are extremely exciting. One is just the fundamental building design. The other is the technology that we've been able to employ in the building. We're just, frankly, extremely excited that we're having private rooms because of the environment it promotes from a healing perspective, from a privacy perspective, and it gives us the opportunity to focus our efforts on the individual in that room. We have the latest and greatest imaging machines, but we're taking technology and putting it at the bedside for patient safety. There's not a day that goes by that I'm not thinking about what's going to happen not only tomorrow, but as my role as Chief Executive Officer, continually monitoring that horizon. What's going to occur in 6 months? Where do we need to be today to position ourselves 3 years from now? And that's really the fun part, when you get to think and envision what we could be and then apply that tactically with the team. It's an extremely rewarding career, and I absolutely love every aspect of it. But the most fulfilling moments are when I'm on a unit or in a department having a very comfortable discussion with one of our employees, and moreover when I have the opportunity to interview our patients and talk with them about their stay, the care that they've received, and That's a very refreshing and grounding experience. We're going to see more knowledge growth in the next 10 years than we've seen in the last 100 years. And you think about what's happened in that century, it's a very profound statement. The challenges for new careers and new executives is going to be how to keep up with that capacity for knowledge. The spectrum of thought and ideas for the future of healthcare delivery are never ending, and in some cases very exciting, in some cases very, very scary. But the fundamental mainstream is, and will continue to be, how do we deliver safe and effective quality care?
This program is brought to you by the American College of Healthcare Executives, an international professional society of more than 30,000 healthcare executives who lead hospitals, healthcare systems, and other healthcare organizations. The leaders of the featured hospitals and health systems are board certified in healthcare management, having become fellows of the American College of Healthcare Executives, signified by the FACHE credential following their names. For more information, go to ache.org.